My name is Rachel Malouf. I'm a level 2 occupational therapy student from Baker College. I've been here at Insight for the past 10 weeks studying occupational therapy practice under Karen Reedy. And today I'm going to talk about occupational therapy and therapeutic use of self. It's not going. It should. Why aren't you working?
Okay, there it goes.
Okay. Thank you. Yep. So to get started, I just want to talk about a little bit about what occupational therapy is and what we do. So occupational therapy is the therapeutic use of everyday life activities or occupations with individuals or groups for the purpose of enhancing participation in roles, habits, routines in the home, school, workplace, community, and any other setting you can think of, really. OT is holistic. We consider the person, the environment that they exist in, whether it's physical or social, and the occupation or activity that is in question for them to promote maximal occupational engagement. These services are provided for habilitation, rehabilitation, and promotion of health and wellness for clients with disability and non-disability related needs. The overall concern with occupational therapy is we want the end result of engagement for our clients and our patients. We want them to be able to engage in any of their desired or necessary occupations. So when we talk about occupations, we talk about anything that occupies your time. So this can be brushing your hair, getting yourself dressed and groomed in the morning, everything from participating in sleep, valued leisure activities, desired sexual activities, and any kind of return to work or school activities. So as such, we need to get very personal with our clients and our patients, and that is where therapeutic use of self comes in. So therapeutic use of self is the use of oneself in such a way that it becomes an effective tool in the intervention and evaluation process. It's being aware of yourself and of the client and being able to control what you are communicating. It's different than your spontaneous interactions that are typical in your daily activities because it's conscious use of your personality traits, your interpersonal skills, and your clinical and theoretical knowledge. It's deliberate and backed by your clinical reasoning, and therefore your self-awareness is very crucial to this process. So why is it important to be able to use yourself as a tool in the therapy process? It's essential to the practice of occupational therapy. We use it in all of our interactions with all of our patients. In a 2009 study of 568 practicing OTs in the US, 80% of respondents rated therapeutic use of self as the most important determinant of the outcomes of therapy. 90% of respondents reported that their relationship with the patient affected occupational engagement, which, as I mentioned, is our ultimate overall goal. Occupational therapy practitioners can use of self to shift the power of the therapeutic relationship to give their patients and their clients more control in the process, which gives them that feeling of self-efficacy and promotes that engagement. So the patients bring to the therapy process their lived experiences, their goals, hopes and dreams for the future, and their needs and priorities. Occupational therapy practitioners bring their skills, their clinical knowledge, their theoretical knowledge about how engagement in occupations affects health and well-being, and therapeutic use of self acts as a bridge between those two things. To be effective in beginning to use therapeutic use of self in your relationships, you need to be able to recognize the individuality of every client and respect their dignity and their personal rights. And you do this you display this in your relaxed manner when you're interacting with them, your humility, your flexibility in the therapy process, your personal self-awareness and insight, your sense of humor and how you apply it to situations, and your thoughtful self-disclosure. And to become effective in the use of yourself, you need to develop your interpersonal skill base. So interpersonal skills include therapeutic communication. This is verbal and nonverbal communication. It involves listening to the patients and the clients and seeking and responding to feedback. Establishing relationships, so this would be building rapport with your clients, setting an emotional climate, and managing impressions and setting boundaries. Understanding families, social systems, and group dynamics. And this requires a fair amount of cultural competency and sensitivity when you're interacting with patients from different backgrounds than you, different social systems, different family dynamics. Interviewing and strategic questioning. So this is very important in occupational therapy. We need to be able to get a lot of personal information from our clients and our patients. So we need to be able to tactfully ask the right questions to obtain the necessary information that we need to provide them with some client-centered treatment for occupations that are meaningful to them. Understanding and managing difficult interpersonal behavior. So when we say difficult interpersonal behavior, this can be manipulative behavior, hostility, dependence, resistance. So it's important to understand where these behaviors are coming from and then have some skill in managing these behaviors should they arise. Resolving empathic breaks and conflicts. This is an inevitability in therapy that these situations will arise. And depending how you handle them in that moment, it can either enhance or hurt your therapeutic relationship that you are building with your patient. Maintaining professional behavior, values, and ethics. So while we are trying to build a strong therapeutic relationship with our patients, we need to also maintain professional boundaries, uphold the values and ethics of our profession. Working effectively with supervisors, employers, and other professionals. This is also an important skill that can ensure effective treatment that is client-centered. And professional development, staying up to date on current practice trends, evidence-based practice, keeping informed of diagnoses that you may not be familiar with as they come up. This can all enhance your competency as a therapist and your comfort in relating to patients, and that will translate into your therapeutic relationships. So keeping these interpersonal skills in mind, practitioners should be aware of which of these skills fall into their own interpersonal strengths or the things that come naturally and that you tend to draw on these skills often. Your interpersonal abilities, these are the skills that you can draw on when you need to, but you need to put a little more effort into it, a little more awareness. And then you have your challenges. And these are things that are more difficult for you. You may avoid them altogether. They don't come naturally. And so knowing and responsibly accepting our limitations and weaknesses in these areas is equally as important as knowing our strengths. And potential challenges to developing these skills could be personal biases, whether you are aware of them or not. They will come up. It's human just to have them, to be aware of them within yourself, and to not let that affect your therapeutic relationship is important. Your mannerisms, so hair twirling or fidgeting, these things can be perceived by your clients, and that can affect the relationship. Same with habits and nonverbal communication. So keeping these in mind and creating a level of self-awareness, this helps us to know which patients or situations may be more likely to be challenging to us or draining emotionally or physically, or even potentially a threatening situation. And it also gives you an opportunity for personal growth and development. So in addition to developing your interpersonal skills It's helpful to become familiar with these therapeutic modes or specific ways of relating to clients. The process of therapy is optimal when therapists are able to draw on a variety of these modes consciously and flexibly. And it's on a moment-to-moment basis based on the needs of the client in front of you at that given moment. So advocating is the first mode. And so this is understanding and responding to physical, social, and environmental barriers. This could be as simple as recommending some equipment to help a client manage their daily activities at home, or advocating for a change on a more global level with policy changes, procedure changes, law changes, things like that. Collaborating, so this is involving the client in the reasoning, in the goal setting, in the intervention process, and giving them some control in the process. Empathizing. This is being able to put yourself in that patient's shoes to understand their physical, psychological, interpersonal, and emotional experience. You need to be actively listening to them and observing and responding to nuances in their affect and behavior. So actively listening to what they're saying and also what they're not saying. Encouraging, so we may find that our clients need some hope and courage, and they need us to motivate them and through positive reinforcement in ways that are meaningful to them. And instructing, so educating the client in therapy, and you'll assume a teaching style that's appropriate for that client. Problem solving, this is the OT's favorite thing to do. We use our skill, our logic, and our creativity to solve problems with and for our clients. So doing this creates a meaningful relationship between the therapist and the patient in order to promote participation and progress in occupations that matter to that patient. Creating an atmosphere of trust and respect through your therapeutic relationship building helps to alleviate fears and anxiety that your patient or client may be bringing to the process. For a lot of our patients, this is a new disability or limitation that they're not used to, and they have a lot of fears about the future or even the present. So we can provide reassurance for them that's appropriate for them. Building an atmosphere of trust and respect helps us obtain that necessary information that we may need to treat them. It could be some very personal and private information that they're not totally willing to give up right away. We can provide appropriate information and advice that is culturally and personally relevant to that patient. And it allows us to have conversations with patients that may be difficult. And they may be difficult because of our own feelings, our own limitations, being afraid of offending the patient or something along those lines. Mindfulness and therapeutic use of self. So by this point, I think we have all at least been introduced to the concept of mindfulness. But mindfulness is a means of paying attention in a particular way, on purpose, in the present moment, and in a non-judgmental way. So this definition by Jon Kabat-Zinn suggests that being mindful is an active state. You're being intentional and you're paying attention on purpose. You're actively listening and responding to your client in the moment. So being mindful will help you be aware of and respond appropriately to those interpersonal events that we talked about earlier. So we're looking for their nonverbal cues, being aware of potential empathic breaks. We are aware if they're testing our boundaries and how we manage that. If your patient or client is being resistant or reluctant to participate, this will help us be mindful of how to get them engaged and can help us prevent crisis points from arising in therapy. Being mindful also helps practitioners draw on those therapeutic modes we discussed, and it helps them determine which mode is most appropriate for that client. and maybe there's more than one mode that they want to use at that time. And active listening requires mindfulness, and active listening is arguably one of the most important things we can do as therapists. So going forward today, I'd like us all to be a little bit more self-reflective, a little more mindful in our relationships and our interactions with our patients today. And think about if you are displaying empathy. Are you trying to put yourself in that person's shoes and truly understand their experience? Are you demonstrating active listening? Are you looking at them? Are you facing them? Or are you kind of over here with the computer and you're half listening? Are you being sensitive? Are you being aware of their needs and the effect on the things that you say and do are having on them in that moment and responding appropriately? Are you showing respect to your clients, your patients as an individual with individual interests, individual needs, and values that may be different than yours? Maybe you don't understand or relate to them, but you should be respectful of that. Are you being authentic? Are you self-aware? Are you comfortable with yourself, and are you putting your best self out there? Are you displaying a sense of warmth in your interactions, enthusiasm for your profession, and interest in getting to know your client and helping them? Are you being generally friendly? Self-disclosure. Are you only disclosing what you're comfortable sharing and what is benefiting the therapeutic relationship and what is not taking focus away from the client? Specificity. Are you stating things simply and directly and concretely in ways that your patient can understand? Are you staying on topic, focusing on what is relevant and important to that patient in that moment? Are you giving feedback in the moment, immediacy and feedback? So immediately after the relevant event takes place, this creates an opportunity for us to learn from successes and challenges. This is a learning experience for both the patient and the therapist. So overall, big takeaway from therapeutic use of self is self-awareness and personal growth, becoming aware of your own biases, your mannerisms, and how you can use yourself to develop a trusting relationship with your patients and clients to create an atmosphere of trust and respect, which will translate into more occupational engagement, which will translate into better health outcomes.